The hosts and guests on Everything's Messy podcast are not licensed healthcare professionals. The discussions in our episodes are not personalized medical advice. Always consult a qualified healthcare provider for medical guidance. Never delay seeking professional medical advice or emergency assistance because of our podcast. We encourage consulting with a healthcare professional before making any significant health changes. By listening to our podcast, you agree to the disclaimer. Thank you for listening to Everything's Messy podcast. Hey, welcome to Everything's Messy podcast, where we celebrate the beautiful but messy life experiences that most, if not all, people go through. Get ready to embark on an exciting journey through the raw and unfiltered stories of everyday people. Here, we dive into messy realities of life, from making messy mistakes to triumphs and everything in between. Are you sensing a theme? That's right, it's messy. But this just isn't about the mess. It's about finding strength and resilience in the midst of it all. We'll explore how health, fitness, and wellness play a crucial role in navigating life's twists and very messy turns. And we'll challenge conventional systems, because sometimes the most unconventional paths lead to the greatest discoveries. Join us as we embrace the messy, beautiful, and endlessly fascinating stories. Each episode is a testament to the power of our messy journeys and the beauty that emerges from the mess. So grab your favorite beverage, coffee, sparkling water, whatever it may be, and prepare to be inspired. Are you ready? Let's get messy. Hey, messy people. Welcome to another episode of Everything's Messy podcast. I am your messy host, Sarah. Okay, it is February, and that means it's Heart Month. So for those of you who have been listening and with me from the beginning, you know that I suffered a heart attack 6 days before I turned 43 years old. It was completely life-changing, life-altering, all the things you can imagine. And I don't really want to get into the origin story. I want to get into some actual raw data and why this is affecting women. And it's not just I have a condition, being a type 1 diabetic. But when I tell you these stats, when I tell you what's actually being collected and what's being said, and it has very little to do with me being a type 1 diabetic, it's going to blow your mind. And I really want to get this message out here. I want women to pay attention, especially not ignoring the men, but this is really crucial that women, you are listening, you are paying attention, and we are going to go over this. And I'm telling you, it's going to blow your mind. You're going to be like, wow, no idea. And that's part of what this episode is going to be about. Why aren't we talking about it? And as I segue into it, one of the things I do want to note is I am not taking away any awareness or any, raising the level of being seen as breast cancer survivors and people that are having to deal with that. This is specifically just going to get in the data that I've collected. I'll give you some sources, and we really just need to dive into this. Okay, so get ready. It's going to get messy. My favorite thing. All right. So heart disease is the number one cause of death for women in the United States, but more than all forms of cancer combined. Okay. Let that sink in for a minute. It is the number one cause of death more than all forms of cancer combined. Okay. This is huge. Why we're not talking about it, why we aren't screaming this from the rooftops, it is beyond me. And, obviously the PR people for breast cancer are doing a much better job getting awareness out than we have working for us on the heart disease side. And we need to get more aware. We need to get active. We need to understand what's going on. And again, I know a lot of you, when you hear my story, you're like, oh, it's because she had type 1 diabetes. It's really not going to affect me. Buckle up. Let's get messy, because it is going to affect you. 45% of women, 45%, age 20 and up, are living with some sort of cardiovascular disease. You ready for this? That's over 60 million women in the United States. 60 million women. That is such a staggering fact that it incredibly should be making every woman wake up right now. And this is 45% 20 and older. 20 years old and older, 45%. That's almost half of us, 20 and older, are living with it. Some of you don't even know, and we will get to the signs and symptoms and all that in a little bit, but I just want to keep going down this rabbit hole of data. So each year, 300,000 women die from heart disease. So that's from the CDC. 300,000 women die from heart disease. That's roughly 1 of 5 every female deaths that heart disease causes. And it's more deaths in women than it is men. What? I thought men were the ones having heart attacks. I thought men were the ones having problems. Why are they coming after women? Are you kidding me? 60 million women in the United States. 1 in 5 every female is a death for heart disease. It just blows my mind. So here's another, just again, we're talking about awareness. Less than 50% of women recognize heart disease as their leading health threat. And let me tell you, I have been reading a ton of data on this. Doesn't matter if you're eating clean. Doesn't matter if you're doing these things. There are some hidden factors that bring us back to hormones and these kinds of things that we really need to be paying attention. Less than 50% of women recognize heart disease as their leading health threat. That's mind-boggling. We need to be making this a top priority. It needs to be saying 100% of us realize this is an important detail in our life that we need to focus on. 100% of us. So heart attacks are increasing among women ages 35 to 54. Hello, that was my age group, right? I'm 3 years post-heart attack, and 35 to 54 ages is who it's coming after. That's staggering to me. And most people think heart attack is an older disease, and it isn't. So when we're comparing it to breast cancer, heart disease kills more than 6 times as many women than breast cancer each year. Heart disease kills more than 6 times as many women than breast cancer each year. I mean, are we waking up yet? Are we paying attention to this? So here is a actual thing off the CDC website. It reports that 305,000 women died of heart disease. 305,000 died of heart disease, and 42,000 of breast cancer. Think about that number, both of those numbers, 305,000 compared to 42,000. Now, either one of these things we don't want to fall victim to, either one. But when you look at how vast the difference is, why is breast cancer getting all the love? I'm not saying it doesn't need to have the love, but where are the huge, big, celebrities or donors or the people talking about heart disease? It's affecting so many more. It's crazy to me. And I don't understand why we can't make this just standard across the board that people are understanding this. I don't understand. So again, a lot of my websites or my fact checking is coming from directly off the CDC, and a lot of them are coming from Hopkins Journal. A lot of them are coming from the goforwomen.org. I mean, there's all of these things that we need to be talking about. These are my sources. Fact check me if you want. I don't think you're going to find anything that's going to be opposite of what I'm telling you. I have looked. So let's get into a little bit about the younger women and heart attacks. Okay. Heart attacks are increasing among women ages 35 to 54. Okay, we've said this. Even as rates fall in older adults. So this is a very interesting thing. Older adults are actually having less of this be a problem for them than it is for women 35 to 54. It is specific for us, for women, because one of the leading causes they put at the top is high blood pressure. It affects nearly half of U.S. women, and it is a major risk factor for heart disease. So we've got half of us affected by high blood pressure, and that it is a major risk factor for heart disease. Because what are we doing? Why is our blood pressure skyrocketing? We need to find ways to relax, chill the F out. I mean, what is going on? And they talk about pregnancy-related conditions like preeclampsia, which I did have a pregnancy where I was preeclamptic. And so These can all significantly raise long-term heart risk. Okay. The other thing they're talking about, because again, women are not recognizing this as their leading heart health threat, we are not getting the heart health assessments regularly. Or we're not even being told by our clinic or doctors, hey, we probably need to check your heart. So this goes back to being your own advocate, my messy warriors. Ask for that heart assessment. I don't care how old you are, ask for it. So as, and we need to, we need to speak up. We need to start asking questions because we're not, and we're missing out on some of the love that needs to be coming towards us for awareness and what we should be doing. So, as February, like I said, is America Heart Month, and the National Wear Red Day kicking off focus on women's cardiovascular health is a reminder that heart disease isn't just a male disease. In fact, it is affecting more women than it is men. And that is just, we need to talk about that. So as I keep reading my notes, I just want to take a minute and be like, this needs to sink in. This needs to grab your attention, needs to grab you by the neck, get you pulled in. If you're not talking to your doctor about it, talk to your doctor about it. And especially women talking to women doctors, they should be more keen to know. Maybe more men doctors know, but either way, you got to be fighting for yourself. You've got to be fighting for yourself, as it is listed as the #1 cause of death in U.S. women. #1 cause of death, right? Okay, so we have to understand the age that we're living in. We are under so much incredible amounts of stress. And I don't want to keep blaming it on that, but we're obviously not doing a very good job with combating that stress. And I'm raising my hand over here going, I didn't either. In fact, I really didn't know how. And I've mentioned several times on this podcast, I didn't even know how to breathe. Taking shallow breaths, barely getting by, not exercising enough, whatever it was. But it is really devastating to me that this is what we're dealing with. So remember, heart disease is, this is a big word coming at you. So, it's multifactorial, meaning it's rarely just one thing that causes the heart disease. Okay. So that's why I want to talk about this. And there's common contributing factors and not so common, but one of the common is high blood pressure. High blood pressure. And why isn't this being caught? Why are we going in and, seeing our doctors and they're taking our blood pressure and nobody's saying anything, right? And they keep moving the goalpost for high blood pressure. We've seen this. We understand it. We're not panicking to a certain amount, but it definitely needs to keep an eye on it. They have tons of these watches and rings and all these things where it can be monitoring your heart rate and your heart and your blood pressure. Let's start utilizing those tools if we can. One of the other high contributing factors is chronic inflammation. I've talked about this on my show over and over and over again. We are chronically inflamed. Why? Because most women, are suffering from some sort of autoimmune chronic condition, and those autoimmune and chronic conditions are not really affecting men. And that is so mind-boggling to people who are trying to study this. They don't understand what's happening. Mostly because if you have suffered from an autoimmune or chronic condition, you know that it does cause a lot of inflammation in your body. This inflammation is hurting our cardiovascular system. And then that's leading to our blood has to pump harder, our heart has to work harder, and all of these things that we're trying to understand. The other thing, insulin resistance and blood sugar dysregulation. Hello. That's where my type 1 comes in. But you need to understand that you can be eating so clean, you can be working out, and you can still be suffering from insulin resistance depending on how your body is working and producing the things that it's supposed to be doing. It's mind-blowing to me. Then we have the not just high cholesterol issue. Okay, let's be very careful because my feelings on everybody, the doctor's telling everybody to take a statin. I don't agree with this. But what they're saying is It's the particle size or the oxidation and ratio of the high cholesterol, right? I'm always telling you, look at your ratio of your cholesterol because that's telling you how big your cells are while it's going through your body. So I think the word is dyslipidemia or something like that. You can look it up and fact check me. But while these are things that we need to be keeping an eye on, remember it's not just one thing. And if you have relatively low blood pressure, and if you have relatively normal, using air quotes, not looking at the new chart that they have for cholesterol, the cholesterol range, then you shouldn't be running and being put on a statin. Okay. These things need to be watched and looked at. And then, look at this. One of the most common contributing factors, chronic stress and nervous system dysregulation. Man, oh man, I am tired of saying those words. I am tired of waking up every day and seeing that that's what I'm dealing with. I am tired of it's not an easy fix. It takes work. And man, some days I'm throwing in the towel. I've had it. And then other days it's like, no, I know what I'm working for. I don't want this to, speed up the end of my life. That's not what I want. Right? Of course, they list smoking. I don't know very many women my age who are still smoking. Doesn't mean that they're not, but I'm not sure that that's a high enough threat that we still have smokers. I'm sure we do. I think it's the older population, but I think we're pretty understanding now that smoking is no good. Doesn't help us at all in a lot of ways. Then, of course, sedentary lifestyle, muscle loss, poor sleep, and nutrient deficiencies. Okay, what am I always telling you? Drinking water isn't enough. Especially because if you're drinking lots of water and not replacing it with electrolytes, the water is stripping what you have left in your body and actually making you more dehydrated if you're not putting those electrolytes back. And what do I mean by the electrolytes? Magnesium, potassium, sodium, and then we also need to be investigating a really good omega-3. Haven't found one yet. That's sort of the one that stumps me, is omega-3s. So here's the big kicker. This was the category that I was in. Many, many women who suffer heart attacks do not present with classic symptoms that are usually the male pattern risk factors or symptoms, right? The left arm hurting, shortness of breath, maybe even your jawline or your chin hurting, those kinds of things. We don't have any of those symptoms. I didn't at all. I honestly, and I've said this before, I thought I was having some sort of panic attack. Nothing hurt, nothing seemed uncomfortable. I was a little bit extra tired, and I had it wasn't even pain. It was just some weird feeling in my pectoral muscle, but it was on my chest. And like I said, I was breathing fine, or at least I thought I was breathing fine. And it blew my mind when I went into the emergency room and they had me on the EKG, and my EKG was inverted. It was W, not M. And that's when they said, you are in the middle of having a massive heart attack. And it was just surreal. I didn't believe it. Okay. So again, if you're looking for these signs, you may not see it. You may not see it. So let's shift, my favorite words, into how does hormones play a role in this? Okay. And then specifically speaking about estrogen. So yes, estrogen can be, and I want to stress this very, very carefully because I don't want you people to come at me and say, well, you said estrogen is bad for us. In our own body, as we are making the estrogen, because our body does make the estrogen before we get into full menopause, it can be cardioprotective. If we are adding copious amounts of the xeno and phytoestrogen from the outside, that is doing the opposite. We are not helping. But the body that is making its own estrogen can be cardioprotective to a point. It can improve blood vessel flexibility, help vessels dilate. It can be a positive cholesterol transport, things like that. But, and this is why they say perimenopausal women generally have lower heart disease risk than men at the same age. But what they're finding is that age is now becoming what did I say, 35 to 50, which is right in that perimenopausal age. But what they're seeing is it's not the estrogen that you're creating inside of you. It is the phyto and xenoestrogens that you're adding on the top of it that is actually doing the opposite effect. Okay, so let's be very careful when we say this, right? And so this is where things get messy, my favorite word. So as we enter into perimenopause and menopause and we're losing the estrogen our body makes on its own, I want to stress this very carefully. It can cause heart disease. Let me back up. It can unveil that you might have a problem, cardiovascular problem, especially because that's when the insulin resistance is really showing, the chronic inflammation, poor metabolic flexibility. So it's really important that we are not estrogen dominant. I've said this before, or we have poor estrogen metabolism. We need to make sure we have the progesterone balance. And with thyroid dysfunction and cortisol dysregulation, these are like think of a Venn diagram. These are in the middle of what's actually spurring on the heart disease. So we can have normal estrogen labs and still have cardiovascular risk if metabolic and inflammatory systems are broken. That's a huge thing. All right. And then, so let's talk about insulin resistance for a minute, because that can be a massive driver in the cardiovascular system. So even women who are thin, even women who are active, even women who are eating clean, you can still have insulin resistance, especially if you also have autoimmune disease, chronic stress, hormonal disruption, long-term dieting, or over-exercising. Insulin resistance damages blood vessels long before symptoms appear. Okay. Then back to the female nervous system, right? So we are far more likely to live in chronic sympathetic fight or flight mode. Okay. So we have chronic stress, which raises cortisol, increases our blood sugar, drives inflammation. It damages all the lining and worsens insulin resistance. Now you might be saying, wait, that's all of the type 1 stuff that you're always talking about. Yep, I am. But all of this applies to those who don't even have type 1, but they're going through this fight or flight in their own way, their own dysregulated nervous system. This is what's happening. So this is why heart disease in women is tightly linked to caregiver stress, mom guilt. Hello, how many times have I talked about that? An emotional labor and a trauma history. So this is a biological weakness, not even an emotional weakness. So we need to be balancing our cortisol, doing stress release, getting down our insulin resistance, really taking care of how we are relaxing, right? You've never heard a man be able to calm a woman down by saying relax. But, however, we really need to be doing that. We need to be calm. We need to be doing things that do relax us, whether that can be the sauna, a walk, anything that we can be able to get out to, we need to make that priority. We can't be continuing to put ourselves last. We just can't. So why do women get missed? This is a really big thing that we need to talk about. Because I told you I didn't have jaw pain, I didn't have back pain, I didn't have neck pain, I didn't have arm pain, right? The symptoms can look, a lot like anxiety. What? Fatigue. Yep. Which is why I thought I was having a panic attack and why I was more tired. So that's really interesting to have that. We are more likely to be told it's anxiety, and they give us anti-anxiety or antidepressants to mask this, when really it could be something physiologically going on inside of us that has to do with the heart. Labs often look normal. How many times do we talk about that on the show? They look normal. Doesn't mean they're optimal. And when you go and you put in, use those little risk calculators online, and it says, let's determine what your heart risk factor is. Typically, the algorithm is based on the male part of what they're seeing. So if you don't check any of the boxes that list the symptoms, they're not going to say that you have any heart disease, right? So, and again, we are getting missed because if we have autoimmune disease, type 1 diabetes, thyroid disorders, hello. I talk a lot about thyroid on this show. I mean, if you really look at my portfolio with all of these things, I'm just it, it kind of starts to feel helpless or, hopeless, but I'm not giving up. I'm not a quitter and I'm not a victim. These um facts though, it really gets you. It really hurts you. And then the last one, they talk about if you have a history of pregnancy complications. Well, I have all of these: autoimmune, type 1, thyroid, and a history of pregnancy complications. Boy, did I win the jackpot, right? Tell ya, you can't help but laugh. And I certainly don't want to focus on that, but it's definitely something that pushes me forward to make sure that I can do everything that I can do that's in my power, right? And this is where it's really frustrating when I am, eating right, trying to lift those weights, doing all of the things, being active. I played at a golf tournament this last week and that was so much fun. I am taking this dance class. I'm trying to do, because again, my word of the year is playful. It's one of the words. And I'm just trying to lean into that. And I don't want this to be the end of my story. But what I do want is for women collectively to come together and be like, wow, we need to get in front of this. We need to strip it all down, get to the root problems and fundamentally build it back up one piece at a time, one domino at a time. That's what I'm trying to do. That's just that's a whole lot of stuff, but it needs to be talked about. And if I can be the person out here screaming it from the rooftops, then I'm willing to do that. I just hope it's catching one person's ears so that you go and you get checked. You go and you fight your doctor to get a heart assessment. You wouldn't think it'd be so hard, but sometimes they need to be reminded that it's not just our anxiety, that's not just our thyroid, it's not just our autoimmune diseases. Maybe our labs are normal, but could you just listen to the ticker, doc? Can we just get an EKG or whatever we can get right now to just put us on the right track? This is why it's important that we try and eat the best we can. Again, 80-20. Because if we go the other way and make ourselves be perfect, we're also going to burn out and that's going to stress our system out. And then we're right back to square one, right? So 80-20 always. Do your calm, stress-free rituals, the breathing, if it's praying, if it's meditating, if it's journaling, if it's going to coffee with a friend, if it's playing golf, which I think sometimes does raise my blood pressure, but I'm having a really good time with it. But these are incredibly, these are facts that cannot be ignored. They are out there. The CDC has a big place that you can go find this. The American Heart Association, same thing. And while I have my opinions on each of those organizations, they're getting these numbers from actual hospitals that are telling you why these people are dying, why the women are dying, why this is happening. And again, go back to that statistic of 304,000 women a year are dying from heart disease compared to 43,000 that are dying from breast cancer. All I'm saying is we want some love for the heart patients, the heart disease ladies. We want some love. And I also want to promote, in a way, maybe that's not a good word, but I want to promote, there should be no shame carried with this. There should be no shame carried with, I have heart disease. Because all of these origin stories that I'm talking about that are coming from stress or autoimmune or thyroid, these are things that are not in your control. So we need to remove that shame piece of, I have heart disease. And, the first people I think people are thinking about is, oh, you ate all the Oreos, or, oh, you have a, bad diet, or, oh, you're not doing enough. That needs to be removed. That stigma needs to just disappear, because we are trying to keep it together. We have been struck down with these conditions that we don't even know where they come from sometimes. We don't even know why our thyroid is attacking itself. I certainly didn't know why the pancreas in my body was attacking itself. And so I don't want there to be a shame associated with this. All we can do is accept it and move forward in the best way that we can, in our best ability. The 80-20, start small, start where you're at. If you come out of the gate expecting all of these perfect things and I'm going to live a perfect life, all you're doing is putting another cog in that wheel and adding more stress to your body. And we don't want that. The raising the cortisol alone, I can tell you firsthand, it is messing me up. It's messing me up. And it's so easy for people who aren't struggling with autoimmune and chronic conditions for them to sit back and sort of Monday morning quarterback what we're trying to do. And I just want to let them know, be grateful for your health if you have it, where you're not having to struggle this. Doesn't mean you were more resilient, or it doesn't mean you were stronger than the rest of us, but hang on to it, take care of it, while the rest of us are trying to move forward without shame or guilt, without feeling bad about ourselves. Okay, it doesn't have to be a death sentence, but it is a wake-up call. Let's make sure, and this is where the support comes in. This is where we've got each other's back. This is where there's no judgment. This is just, it is what it is. And autoimmune and chronic conditions affect so many women. So many women. And when you read that statistic that I just read about anxiety, where we're having all this anxiety, when really that could be our heart sending us a message going, hello, hello. These are things that we're either carrying around as trauma, caregiver guilt, mom guilt, taking care of everything and everyone besides ourselves. This is something that we just need to take a deep breath and go, okay, here's my diagnosis. Here's what I want to do with it. I'm going to maybe follow some more Chinese medicine or functional medicine routes versus the conventional medicine route, and just see if I can get to a place where I can control my stress, or at least I have tools that I can use to release or relieve that stress. And I'm going to continue to do that. And I'm not going to be guilty taking time for myself. And I'm not going to be, I'm not going to be ashamed to reach out for help and ask for support, because I'm not ashamed. It's scary, and it's definitely an eye-opener, but I'm not a victim, and I'm not going to be ashamed. So I hope I can leave you with, even if just one person says, whew, that was a lot of mess, Sarah, but I hear you and I am going to go get checked. Then I will feel like I have done my job. And hopefully there's more than one of you. I'd love to hear your own stories. I'd love to hear what you're checking. I'd love to hear if, you do think it's a chronic condition or anxiety that might be, holding you back, or maybe you think you have, heart disease, you don't know how to get checked. Let's talk about it. Let's find the resources you need. Let's get together and support each other. And if anything, let's just bring more awareness, especially to my younger females out there. You're not absolved from this. You're not safe. Nobody is safe, especially women, and especially with all of these chronic and autoimmune diseases. Let's see what we can do. Let's see if we can just slow it down a little bit anyway. That's the key, right? Slow it down. So, all right, my messy warriors, that is it for this week. And we will see you later. Thanks for listening to Everything's Messy podcast. Whew, if you made it this far, give yourself a gold star, or at least a nap. Honestly, if you showed up today and you were listening, you've already crushed it. I'm so grateful for you listening. If anything hit home, share it, tag me, write it on a sticky note. I don't care. Just don't keep all of this messy goodness to yourself. You can find me on Instagram at Everything's Messy Wellness, or over at my website, everythingsmessywellness.com, where I've got resources, coaching, and probably a new rant about blood sugar or something that's just nonsense. It's all waiting for you. Check out my YouTube channel. I've got all of my podcast episodes up there. And I'm on X at Everything's Mess. Or if you just want to send me an email, Sarah at everythingsmessywellness.com. Look, until next time, hydrate, take no crap, and as always, keep it messy.